This presentation, focused on integrated care management, is brought to you by the Clinical Education Department at HCR Home Care. The objectives for this presentation are for participants to be able to identify the principles of adult learners, understand effective strategies for the teach-back method, understand the basics of health literacy, identify strategies for motivational interviewing, and overall to develop a foundation to maximize patient interactions to meet patient goals more efficiently and effectively. The majority of patients we work with in home care are adults. In order to be most efficient in working with this population, we all should have a basic understanding of the principles of adult learners, if not just for our patients, but for ourselves as learners. Principle 1 is that learning is enhanced with positive reinforcement. Utilizing positive praise reduces anxiety and assists in cementing learning. As clinicians, we should try to identify what areas are a strength for our patient and positively encourage those strengths. The second principle is that learning is enhanced by integration and connection. Utilizing and connecting teaching to life experiences will help a patient retain information. It can help to ask the patient about their life story and see if you can draw connections to previous life experiences to the current teaching you're attempting to provide. The third principle is that knowledge is enhanced by activity. Even among us as clinicians, we are more apt to learn if we are allowed to actively participate. For this reason, you want to have your patients demonstrate skills whenever possible. For example, you want your patient to demonstrate testing their BGs after you've taught them how to test. The fourth principle is that learning must be relevant. If the teaching you're providing lacks personal relevance, the learner will likely be distracted and less likely to be engaged in the learning. For example, we need to do our best to explain to a patient why their home exercise program focused on strengthening will improve their ability to meet their goal of going to their granddaughter's wedding. One step further, we should give the patient options. For example, explaining the relevance of their strengthening program to the goal of attending the wedding, and then asking the patient, what strengthening activity would they like to start with? Principle 5 is that adults learn best by solving problems. Patients will learn best if they can identify the problem, develop a solution, implement their own identified solution, and evaluate the success of their solution. We should ask questions like, what do you do if your blood sugar drops to 40? What could you do if your blood sugar drops when you're out shopping? These types of questions allow the patient the ability to problem solve and apply what they've learned. The final principle, Principle 6, is learning is enhanced when memory is not overloaded. Patients are likely to learn less than 50% of the information provided by a clinician if they are overwhelmed or overloaded with information. Older adults can only tend to learn 2 chunks of information in one sitting. When chunking information, chunk one concept, then check understanding before moving forward. And remember, always teach the most important concept first. This concept, developed by Edgar Dale, identifies the percentage of information that will be retained after 2 weeks, giving a variety of delivery methods. For example, only 10% of information will be retained if we only read the information. 20% of what we hear will be retained. 30% of what we see will be retained. Now, if we start to combine senses, 50% of what we see and hear will be retained. The base of the triangle is where we actually move into active involvement in learning. If we provide active discussion or are allowed to express ourselves, we will retain roughly 70% of the information provided. Finally, 90% of information will be retained if we are given the opportunity to say and do. Activities like presenting, simulating, role-playing, or especially doing the real thing will allow the learner to reach that 90% retention rate. Let's do a quick review of the teach-back method. Remember that 40 to 80% of medical information is immediately forgotten by patients, and of the limited information that is retained, nearly half is retained incorrectly. Teach-back is our best method for providing information and then asking the patient to return demonstration or verbally restate the information that they had learned. This will allow us the opportunity to identify areas where the patient effectively learned and where they may need additional education to retain the information. If a patient cannot effectively teach back, reteach and utilize the teach back method again before moving on to a new concept. To be successful in teach back, we should always ask the patient for permission to provide information. This allows the patient to feel engaged in their learning. We should also introduce the method of teach back by emphasizing that we want to make sure that we did a good job explaining the material. We should also avoid shaming statements, which may make the patient feel insecure if they didn't learn all or any of the information. Saying things like, "Did you get that?" "You already know this," "We've gone over this before," can make the patient feel that they should be ashamed if they didn't retain all the information. This is going to limit the openness of the conversation and limit our ability as clinicians to know how much the patient has learned. Using non-shaming statements like, "I want to be sure that I was clear," "We covered a lot of information today quickly. I want to see if I explained the information clearly to you." These statements allow us to demonstrate empathy to the challenges of learning the content. Finally, avoid saying things like, "Do you have any questions?" This is a statement that can sound insincere. Saying something like, "What questions do you have for me? I have time," allows the patient to feel like we assume that they will have questions, and we have allowed time for those questions. Health literacy is the ability to read, write, and understand healthcare information. This is not to be confused with literacy, which is solely the ability to read and write. Just like we apply universal precautions to infection control, we need to also apply universal precautions to health literacy. We need to assume that all patients have poor health literacy when it comes to understanding healthcare information and utilize strategies such as speaking slowly and using simple layman's terms. We should begin teaching with the most important information and repeat the information and instructions. Repetition will improve understanding and retention. Utilizing teachback is a great way to ensure the understanding and the patient's level of health literacy. Also, make sure you are providing printed materials whenever possible that are simple to understand. When working with patients who will benefit from a behavioral change, such as changing their diet, exercising more regularly, or eating the right type of food consistencies, we need to be able to accurately assess their motivation. Motivational interviewing is a communication skill which allows us to motivate our patients to make the necessary behavior change. We can remember these strategies for motivational interviewing through the acronym of OARS. Open-ended questions, affirm positive talk and behavior, reflect on what you've seen or heard, and summarize what's been said. Utilizing open-ended questions will allow us to have insight into the patient's strengths, barriers, and desires related to the behavioral change. Ask questions like, "What would you like to have happen as a result of our care?" "What would you like to be able to do that you cannot currently do?" "Tell me what it's like to have diabetes." "I'd like to give you the best care possible. Can you tell me more about what you would like to get from my visit today?" When you're talking with your patient about various behavioral changes, make sure to affirm positive talk and behavior. Recognize your patient's strengths, as this will build their confidence. Celebrate the small successes, such as when your patient tells you that they only had 1 can of soda yesterday. Although you may have wanted them to have no soda, you should celebrate the success that they have achieved in the right direction. Another example is if your patient mentions that they only smoked 3/4 of a pack of cigarettes yesterday versus the usual full pack. We want to give praise of this accomplishment. Reflecting and summarizing are ways to apply active listening, ensure you fully understand the patient's perspective, and to help guide the patient in the conversation. You want to restate what you heard the patient express, which may be their desires or the challenges of meeting those desires. You should always have empathy towards the challenges the patient may be facing in achieving their goals. Reiterating the patient's feelings is a great way to help the patient know we understand their perspective. By utilizing reflection and summarization, we will be allowing the patient to keep talking about change. The more a patient can talk about behavioral change, with the positive affirmation from us as clinicians, the more likely they are to actually make the change. Statements that demonstrate reflective listening include, "It sounds like you feel," or "It seems as if," or "What I hear you saying is," and "I get the sense that." Each of these allows us as clinicians to ensure that we fully understand the patient's perspective. Summarizing is a great way to ensure that you got it right. It also allows you to sum up the conversation before moving on to another topic, which will allow the information to be retained better by the patient. An example of using summarization would be to say, "It sounds like heart failure has been affecting what you can do. This has been difficult for you, but you want to work on reducing your salt intake. Have I got that right?" Old techniques for behavioral change have focused ineffectively on scaring or begging patients to make changes. These techniques are antiquated and ineffective. Clinicians who are well trained in education, teaching, and directing patients are going to be more effective in influencing change, especially when it comes to patients who have chronic conditions. In conclusion, we can maximize patient engagement, motivation, and learning if we uphold the principles of adult learning, including utilizing positive reinforcement, developing connections to previous experiences, allowing for active involvement, drawing connections to identify relevance to the patient, allowing the patient to problem solve, and avoiding mental overload. Utilizing the teach-back method is a great way to ensure your patient understands the information. But remember to always use non-shaming language. Remembering that whenever teaching, we must apply universal precautions to health literacy and not assume that our patients understand medical terminology, terms, or concepts. Finally, applying motivational interviewing strategies such as the OARS acronym, open-ended questions, affirming the positive, reflective listening, and summarizing, we will be more effective in coaching our patients through their behavioral changes. If you have questions about any of the content from this presentation, you can contact the Clinical Education Department by using your lookup and searching C Education. Have a great day.